Yes, my name's Colette Hawkins, and I'm an academic consultant in palliative medicine based in the northeast of England. And I worked as a clinical consultant in Durham for many years. I have an academic portfolio now, largely because I am very interested in um, gaps in how we deliver care in the NHS and the needs that people have that we're possibly not meeting as we should be. So I've spoken to people who have been through in caring roles or cared for people that they've looked after, who have developed such a wisdom from their own experience and often quite hard experience where they've had to battle to get services and advocate for somebody that they're looking after against services who put up a lot of barriers. But because they've come through that, they have a tremendous amount of knowledge that they are desperate to share with other people because they know that's a difficult experience. And one of them even described the army of carers. You know, there are thousands of us, she said. We've learned this through often quite difficult experience, and we've got this wealth of knowledge. We want that to be used. And speaking for myself, I think that I very much had a clinical focus. That was what I was comfortable with. And I really didn't understand the struggles that people had beyond the illness that I was treating. And I was quite naive, really, in terms of how much life is turned upside down by a serious illness and how many people that then impacts. I was not particularly in tune with the impact on people looking after the person who's ill. But in running Roots to Rights research, we've had quite a lot of conversations with members of the public, both people who are ill themselves and people who support other people who are ill. And it's really lifted the lid on how the breadth and the impact of some of these non-clinical issues that people face that we just aren't engaging with in specialist palliative care circles. And that's certainly been my experience. Communities offer something that palliative care services, by and large, are not offering, and to some extent, perhaps don't have the capacity to offer. And it makes no sense not to use knowledge and local wisdom that is there for the taking. And these are people who want to be sharing what they've learned. These are people who have the life experience that walking through that, it puts you in such a powerful position to support other people. It makes no sense not to capitalize on that. It's just missing a huge part of need. And if especially palliative care services don't offer that, there is a massive gap. So we have to, which communities are filling. If we're working independently of each other, it just doesn't join up.